topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Good morning, Texas. Welcome to another Ask the Experts, where for the last 6 years, we have brought you the top experts in the field of legal, health, financial, and home improvement. I've got to tell you, somebody asked me a couple weeks ago, who are your demographics? And if you look at our shows, estate planning shows, we have hearing aid shows, we have eye surgery shows, and our biggest show around the country is Medicare. It is without a doubt become our number one show. So that shows we have an older audience. And Texas is one of our most important markets. We were so lucky and so blessed to find Jill Belvin with the Belvin Insurance Agency. Good morning, Jill.
Good morning, Steve. How are you?
I'm great. We were so lucky to find you. And I got to tell you, there's so many people who do not understand Medicare. And I'm sure you get those calls all the time. And this show is, I'm going to tell you, this show is to remind people, to educate people. Don't try to do this yourself. Get a good agent like Jill, because I did it the wrong way when I first got Medicare. And I had a bad agent. And
Oops.
I have learned over the shows we've done, Jill, you are one of the finest Medicare agents, and we're going to educate you on this show. Tell people about your company, Jill.
So I founded the Jill Belvin Insurance Agency over 24 years ago. Over the past 6 years, I have really turned my focus to Medicare. There's such a need for understanding Medicare, and people are very confused when it comes to choosing Medicare. It's like you said, Steve, don't try to do it yourself. I very rarely find a client or a prospect who understands what they're doing with Medicare. It's far and few between. A few people have, tried to do it themselves, but the issue you run into is you don't have anyone to let you know if there are any upcoming changes in the market, if your company that you've chosen is taking rate increases or pulling out. That's where, having a great agent comes in, not only to help you determine what's the best plan for you, but also to help you in the future to understand the market and what's going on in the Medicare market space.
You do all the legwork. I mean, that's the bottom line.
Mm-hmm.
And it's so important, Jill, because I'm seeing the questions that people are writing us. And a lot of them, of course, now want to know about Medicare Advantage. And is it almost over with?
So there is an open enrollment period still going on throughout the end of March for people who are on a current Medicare Advantage Part C plan. They do have an opportunity to review their plan and make additional or different choices before the end of the month. If you don't get to it by the end of the month, there still could be an opportunity. There are in some areas, there are special enrollments due to moving to a new address, maybe a FEMA disaster that's happened throughout, that zip code or county or to state. There are some that are covering the state of Texas at this time. But yes, there's still open enrollment going on through the end of March. Different than annual enrollment, which occurs October 15th through December the 7th. But yes, there are still opportunities to review your plan.
So, Jill, with the demographics, a little older demographics that you target, and I got to tell you, a lot of those people get mail and they just toss it. And I am seeing from letters that there's a lot of Medicare Advantage companies that are pulling out of cities or counties.
There are.
People don't even know about it. Threw their mail away.
Yeah, they don't, if it comes from the company that you actually are insured with, you should look at that information just to be certain. If you have any questions about a mail, a piece that you get, if you have an agent that you can talk to, please reach out to that agent. Or if you have questions, reach out to me. I'd be happy to answer your questions. I have my clients reach out to me constantly, sending me photographs of what they've received in the mail and asking, what does this mean? I can clarify that. And if you have a good agent that you're working with, they should be able to clarify that information for you and answer any questions you have about a mail piece. What you don't want to do is pick up the phone and call the number on the mail piece. Please do not do that. You could end up in a world of trouble if you do.
Well, I think a lot of people do that because some of these ads you see, are too good to be true. They probably are. And they
not everyone qualifies for what they send you in the mail.
Right.
Not everyone qualifies for those things. You have certain criteria to meet to qualify for some of the free grocery card or money that they tell you they will give you. Yes, there's certain qualifications or criteria for that. So,
do you like Medicare Advantage?
Do I like Medicare Advantage?
Yes.
Yeah. I mean, there are two different options when folks go on Medicare. There is the Medicare Advantage Part C plans, and then you have Medicare Supplemental, which is like a Medigap plan. I like them both. The customer needs to know the differences between the two, and that's what I do. I educate because not one plan is going to fit everyone. It depends on a lot of factors, budgetary factors, health factors, what prescription medications they're taking, whether they need supplemental benefits such as dental, vision, and hearing. There's just a lot of different factors that people need to consider when making a choice between those two options.
We do this every show, but we get so many questions. Would you mind explaining Part A, B, and D?
Yes, Part A and B are going to be your foundation of Medicare. That is your traditional Medicare. Part A is hospital coverage. Part B is your doctor coverage. And of course, your D is going to be a prescription plan, which is necessary when you go on Medicare. If you don't have a creditable prescription plan, you must have that. Remember, Part A and B are what is provided to you through Medicare and Social Security. That is what you have been paying for in your paychecks over the years, to get Medicare. That's Part A, hospital, Part B, doctor. It is not free of charge. Part A is typically free of charge if you've worked in your required number of working quarters they require. There is a premium for Part B, the doctor coverage. That premium in 2026 is $202.90, I believe. So it's just over $202 per month. But that is your foundation of Medicare. That's your basis. You must have that in place to get any type of supplemental, such as the Medicare Advantage or the Medigap or Medicare supplement in place.
What are the differences between Medicare Advantage and the Medigap Medicare supplement plans? And
There's a
which ones do you think are the best?
There are a lot of differences, and you cannot say one is better than the other. You just need to know the differences between the two and know what works best for you and your situation. Some of the differences between, Part C, which is Medicare Advantage, and your Medicare Supplemental or Medigap, the supplemental and Medigap are issued by private companies, but they go with Part A and Part B. Part A and B remain primary coverage and pay 80% of hospital and doctor costs. The Medigap, which is issued by the private insurance companies, comes in and rides alongside Part A and B and pays the additional 20% of those coverages, the hospital and doctor. The Medicare Advantage is different. It basically takes over for Part A and B. You still have to have Part A and B per Medicare guidelines. However, your Medicare Advantage plan is going to cover all of that type of, that health coverage that A and B would have covered. So A and B no longer pay anything. It is all up to the Medicare Advantage plan. They are the primary plan at that point.
I want to tell people something because a lot of my friends, Joe, would tell me, don't go on the Advantage program. Or no, I'm sorry, don't go on a PPO. Don't go on an HMO. Go on a PPO because I could, choose my doctor. I went on HMO, and Jill, I got to tell you, I have had the best luck with specialists.
Yes. So the difference between a Medicare Advantage, PPO, and HMO is really not the ability to choose your doctor. Okay. And I'll tell you why. You're going to want to, with any Medicare Advantage plan, whether it be HMO or PPO, you want to stay in your network of providers for the plan. Okay. It doesn't matter which one you're with. The difference being PPO would allow you to go outside network if you chose to do so. The cost is very high. It is expensive to go outside the network with a PPO plan. That's why most people choose to stay in network, no matter if they're with HMO or PPO. Let me tell you the biggest differences between having an HMO and PPO. The biggest difference is prior authorizations and prior approvals. So with an HMO plan, it always requires your primary care doctor to give you prior authorizations for tests such as MRIs, CT scans, X-rays, pretty much anything, surgery, if you need to get that done. The HMO is going to require your primary doctor to give you authorizations. If you need to see a specialist, you must have an authorization with an HMO. The PPO gives you more flexibility with prior authorizations and prior approvals and seeing specialists. So you have a little bit more flexibility there. Well, a lot more flexibility, really. But you do give up a lot if you go with the PPO. You do have a very high copay for most things, like a specialist visit with your specialist doctors, your hospital copays. Even the max out of pocket is much higher with a PPO than an HMO. So you have to weigh the differences and decide, is it really that important to me to have that extra flexibility, not to have to get the prior authorizations and approvals? Or am I willing to jump through those hoops or do those things necessary to go to my primary doctor and get those things done with an HMO? That's really the bottom line on that.
So we just got a question in from Sugarland. What happens if I choose the wrong Medicare Advantage plan? Can I still make a change in 2026?
Yes, yes, you can. As long as you do it before the last day of this month. So by March 31st at midnight, please contact me or someone, a qualified agent, to talk through the plans with you and find out what is it that's not working with your current plan. What is it not, fulfilling for you? What gaps do you have there? And try to find you something that will actually be of benefit to you and fit your needs.
Jill, I think either last show or show before that, I really learned something from you. I was so
Mm-hmm.
surprised about
Mm-hmm.
is I thought, I saw where the president is getting a lot of the prescription drugs lowered, and I
Mm-hmm.
thought that would reflect. But you shared with me that the drug
Mm-hmm.
prices are already at their lowest already with Medicare. I didn't know that.
Well, when I don't know that I said that the drug prices were at their lowest, but the way that the Medicare prescription drug plans work, whether it be contained in your a standalone plan or contained in your Medicare Advantage plan, they have different tier levels for certain prescriptions. Some of them are generic and they're going to be labeled like a tier 1, 2, even some folks or some companies say a tier 6 is a generic, but they label them into tiers. Each of those tiers, they have either a zero copay or maybe $1 or $2 for the generics. Those generic type prescriptions do not go towards your any prescription drug deductible that you have, which most plans have anywhere from a $300 to a $600 prescription drug deductible, but that doesn't apply to generic drugs. Now, when it comes to higher tiered medications, they are going to, of course, cost more, and those are going to go towards your prescription drug deductible. However, once you meet what is called a max out of pocket for prescription drugs, and that would only be if you have several high tiered prescriptions that you would ever get to this point. But that max out of pocket for prescriptions is $2,100 annually. So you would never go above that. It has been capped. Also, they have, the government has taken away with the Inflation Reduction Act, they have removed what was called the donut hole. The donut hole was a coverage phase that used to be in Medicare, where you would pay a very high copayment towards any high tier prescriptions, but that has been removed. So the max you will ever pay, even if you have very expensive prescriptions, as long as they are on formulary with the plan, would be $2,100. One other quick piece of information for those of you who are dealing with high cost prescriptions. Let's say you do have to meet that $2,100 per annual. Every prescription drug plan has what is called a prescription payment plan available to you. All you have to do is call them and ask them to be added to the prescription payment plan. That payment plan will allow you to take those high copays and spread them out throughout the year so that you're not having to come up with $600 in the months of January and February, or $2,100 over the first quarter of the year. You could actually spread it out. It doesn't lower your cost of your prescriptions at all. So don't quote me on that. It does not lower it. It just allows you a payment plan to pay it out throughout the year. And it's called the prescription payment plan, or the 3 Ps.
So I'm not trying to embarrass you, but I want people to see you are so easy to understand. And when it comes time to Medicare, there is so much to know. Our last question is also from Sugarland. They want to
Okay.
know, do doctors in network change every year?
They can with the Medicare Advantage plan. Okay. That is also a big difference between Medicare Advantage and the other plan we were discussing, which is the Medigap or supplemental plans. With a Medigap or supplemental plan, if a doctor takes Medicare, they take that plan. There are no networks with that type of plan. But with a Medicare Advantage plan, that can definitely happen on an annual basis. And it sometimes happens during the year as well. I've seen it happen during the term of the year. So it doesn't even necessarily have to be at the beginning of the year.
Jill, how do people reach you?
They can reach out to me on my website, which is www.insurewithbelvin.com. I have a contact form there on the website you can fill out to schedule an appointment. 832-281-4474 is my office telephone number, 832-281-4474. Also, you can email me, Jill, Jill, loves, Loves, Medicare @gmail.com.
Again, the name of the agency is the Belvin Insurance Agency, and we'll be running the show again this month. And Jill will be back again with us next month with more Ask the Experts. Thanks, Jill.
Thank you, Steve. Have a great day.
You too. That's Jill Belvin. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.